I'm Jenna Godlewski, an attorney with Pruitt's healthcare team. I focus my practice on helping clients navigate regulatory compliance and reimbursement issues. Today, I want to highlight what it means to be on the CMS Preclusion List. Placement on the CMS Preclusion List is different than placement on the Office of Inspector General, or OIG, exclusion list, which is a familiar sanction to providers and administrators in the healthcare realm. Placement on the CMS Preclusion List usually goes hand in hand with the CMS Revocation. A comparison of the differences between the OIG exclusion, CMS Revocation, and CMS Preclusion processes is helpful to understand the consequences to providers who receive these sanctions and to healthcare entities who need to screen their providers to prevent incorrect and potentially fraudulent billing to federal payers. OIG exclusion typically happens when a provider has been convicted of certain felony and misdemeanor crimes or has been suspended by a state medical board. There is an appeals process for exclusion. Excluded providers are listed in a database available to the public on the OIG's website. As part of their compliance program, healthcare entities should have a process for checking this OIG exclusion list to screen their providers and contractors. How then is CMS revocation different than OIG exclusion? It is different in a few ways. The reasons for revocation can be the same as for exclusion, but also for reasons related to a provider's Medicare participation, such as abusive billing practices or failure to report a change in enrollment. Usually, a re-enrollment bar is imposed with a revocation. A revocation can be appealed, and if good cause is found, a late filing will be accepted. There is no public database accessible to healthcare providers or the general public to look up providers who have been subject to a CMS revocation. How then is CMS preclusion different than OIG exclusion? A healthcare provider added to the CMS Preclusion List will be precluded from receiving payment for Medicare Advantage services and items, as well as Medicare Part D drugs. A provider can be placed on the CMS Preclusion List at CMS's discretion based on criteria that the provider, 1, is currently revoked from Medicare, under an active re-enrollment bar, and CMS has determined that their conduct was detrimental to the best interests of the Medicare program, or 2, the provider has engaged in behavior which CMS could have revoked had they been enrolled in Medicare, or 3, the provider has been convicted of a felony under federal or state law within the previous 10 years. Of note, providers not enrolled in Medicare can be placed on the CMS Preclusion List. Finally, there is an appeals process for providers to appeal placement on the CMS Preclusion List. Typically, if a provider is placed on the CMS Preclusion List, the provider's Medicare enrollment is concurrently revoked and a re-enrollment bar is established. The revocation, the re-enrollment bar, and the placement on the list can be appealed simultaneously. Medicare Advantage plans and Part D sponsors can access the CMS Preclusion List via an electronic database, and they are charged with notifying their members about the precluded provider. However, the general public, which includes healthcare entities, does not have access to the CMS Preclusion List. How does this lack of transparency regarding CMS revocation and the CMS Preclusion List cause compliance issues? An OIG excluded provider is automatically placed on the CMS Preclusion List. However, a provider can be revoked from Medicare and/or be on the CMS Preclusion List and not on the OIG exclusion list. Currently, healthcare entities have no way to know if their providers are revoked or precluded by CMS unless they receive the written notice from CMS, the sanctioned provider notifies them, or claims submitted under the sanctioned provider are denied. The lack of transparency by CMS is unfair to healthcare entities who are charged by CMS with screening the enrollment status of their providers when they participate in federal healthcare programs. In conclusion, OIG exclusion, Medicare revocation, and CMS preclusion are 3 very different sanctions, but they are usually related. Providers and entities must understand the different effects of these sanctions and know that all these sanctions are soon to follow after criminal convictions and state board or licensure issues. Healthcare entities need to closely screen their providers and claim denial reasons to ensure the compliant billing of their rendering and ordering providers to Medicare and other federal payers. If you need assistance navigating the OIG exclusion, Medicare revocation, and/or CMS preclusion appeal processes, or have questions regarding implementing compliance screening measures for sanctioned providers, please reach out to Pruitt.